Hello, sorry for running behind due to some technical difficulties. Welcome to our webinar series. Thank you for tuning in. I'm Dr. Jennifer Nevels, the moderator for today. Today's topic is the relation of autism to hypermobility EDS, ADHD, anxiety, Cirs, and PANDAS. The presentation is given by our very own Dr. Jason Porter. Dr. Porter received his doctorate in naturopathic medicine at the Southwest College of Naturopathic Medicine in Arizona. He graduated in 2003, and together we opened up East Valley Naturopathic Doctors in 2006. Dr. Porter is also a board-certified neurotherapist, where he has started a neurofeedback clinic within our practice. Dr. Porter is a phenomenal physician due to his passion in helping people, his abilities to uncover the underlying health issues, and brilliance in finding solutions. He particularly is passionate about our topic today. A couple of things to mention before we get going. If you have any questions, please enter them in the comment box on your screen. We'll do our best to answer as many as we can at the end of the talk. So without further ado, Dr. Porter, take us away.
Thank you, Dr. Nevels, for that wonderful introduction. Here I have on our opening screen a picture of two children. These are my two children. They are very special to me, and partly because it took a lot of work to get them. They're both adopted, and you wouldn't recognize them if you saw them today. This is when they're much younger, but they started out in their early years with some special challenges, and we'll be talking about some of those challenges today. And so that's kind of how I got into this work, is just trying to help my children. We're talking about today the relation between autism and to a few diagnoses, Ehlers-Danlos, ADHD, anxiety, Cirs, and PANS and PANDAS. And we have some objectives that I'd like to accomplish today. One is I want to recognize a diagnosis does not describe in any degree the total individual. A child with autism is going to have a learning disorder and have other physical disabilities. Again, names or diagnoses can be very misleading. Symptoms and conditions can overlap one on another. And so we may assume a child with autism those symptoms may be associated only with that condition, and they don't get the help they need in other ways. We know there's ongoing research and opportunities for therapy. It's ever expanding. This is any diagnosis we talk about today is not an end game. And we're going to talk about therapies that synergize with one another, meaning they compound. One therapy adds benefit to the other. And we're going to talk about evaluating and testing, which help to determine the best paths of treatment. I want to define, before we go further, as again, some of these things may be new, but just want to define a few of these topics before we discuss them in treatments. Autism or the autism spectrum disorder is a developmental disorder that appears in children, generally within the first 2 to 3 years of life. Common challenges with developing expected social skills, repetitive behaviors, emotional outbursts, difficulty with or complete absence of speech, and nonverbal communication. Autism can manifest in unique and variable ways, which is why it's referred to as a spectrum disorder. There are many subtypes of autism, and each person will have their own strengths and challenges. In our office, we have a 10-item checklist to assess and evaluate each child, and not one child is similar or the same as another. Most of the autistic population is considered idiopathic with causes unknown, but likely the result of simultaneously complex polygenic or multiple genes and environmental interactions. EDS, Ehlers-Danlos Syndrome, is a hereditary connective tissue disorder with 14 currently recognized subtypes, 13 of which are considered rare, resulting in subclinical lax to very lax connective tissue. The picture on the left, his name is Gary Turner. He holds the Guinness Book of World Records for most hyper-flexible individual on the planet. In the middle, we have a typical teenager with hypermobility who is very flexible in different ways. She's probably in dance or in gymnastics. And then we have on the right a picture of an individual with extreme flexibility in the wrist. This is a common way to review or diagnose Ehlers-Danlos or hypermobile EDS. Genetic testing is able to rule out the 13 known rare types. Various criteria, including the Baton scale, can help define hypermobile EDS types. And this gets confusing. There's some different classifications and they're changing. 80 to 90% of EDS cases are known as hypermobile EDS, and they have no known genetic association. Individuals who've been previously diagnosed as EDS are now classified as generalized hypermobility spectrum disorder, and which now takes place or is in place of the joint hypermobility syndrome. As we learn more, again, the nomenclature is changing. Hypermobile spectrum disorder is defined by generalized joint hypermobility, which you can see often in the wrist, in the elbows, certainly in the back or the spine. But it can also lead to some different issues such as chronic musculoskeletal pain or instability. And some of these youth and children with hypermobile will also have scoliosis often. Attention deficit hyperactivity disorder is the most commonly diagnosed psychiatric disorder in children. Worldwide, 5% of all children. 50% of the cases will persist through adolescence into adulthood. Untreated ADHD leads to a variety of problems such as poor academic performance, poor socialization, and increased traffic accidents. Even with appropriate treatment, around 20% of all children with ADHD fail to respond to psychostimulants, and most responders are still left with some deficits into adulthood, of course. Anxiety. Anxiety is a persisting mental health disorder associated with excessive or unfounded worries, fears, or phobias, which results in separation anxiety or avoidance of social interaction. In children, the onset can be sudden, as in PANDAS, or gradual over many months. The symptoms may be mild to extremely debilitating, interfering with daily activities such as social interactions, schoolwork, and family relationships. Sleep disturbance is a common co-occurrence. In children with PANDAS, for example, separation anxiety may present, disrupting the ability to transition easily from the caregivers, parents, to a school classroom setting, for example, or to family members or friends. This may be new for a lot of people. Chronic inflammatory response syndrome. This is a biotoxin. And a biotoxin basically is a toxin that derives from a living substance, such as mold. But this is a biotoxin triggered immune dysfunction disorder. The immune dysfunction produces very complex multisystem, so meaning it can be in the gastrointestinal tract, or it can be in the cardiovascular system, or the skin, or the nervous system. And it's multi-symptom illness, and this follows an exposure to biotoxins such as mold. The majority of the population is able to sufficiently clear these substances with minimal long-term consequences, but an approximate 24% of the population possesses a genetic determinant known as HLA type that leaves them open to biotoxin-triggered immune dysfunction. That becomes a chronic, persisting illness or disease. Mold in water-damaged buildings and on food, along with yeast or candida in the intestinal tract, are the most common chronic exposures. Symptoms of active Cirs, or this chronic inflammatory response syndrome, looks like and acts like chronic fatigue syndrome, fibromyalgia, anxiety, depression, leaky gut, POTS, and chronic Lyme disease. Within the pediatric population, Cirs can look like and overlap with PANDAS, autism, ADHD, and possibly hypermobile EDS. PANDAS is a sudden onset or pediatric autoimmune neuropsychiatric symptoms, known as PANDAS, is a sudden onset of psychiatric symptoms in children arising from an autoimmune or an inflammatory response directly affecting the brain. It presents as a sudden onset of behavioral changes such as uncontrollable anger, emotional outbursts, anxiety, obsessive compulsive disorder, and physical or verbal tics. If not treated, it may persist for years and even into adulthood. If not diagnosed correctly, often they get prescribed antipsychotics, which is a concern for, should be a concern for any parent for their child to be on. One of the most common presentations of PANDAS results from a bacterial infection known as group A strep, which results in a form of PANDAS known as pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections, or PANDAS. And PANDAS is familiar to a lot of you. Patients suffering from PANDAS or PANDAS will show sudden onset of many of the following symptoms: difficulty with eating, anxiety or irrational fears, extreme changes in mood, outburst of anger, aggressive behavior, regressive types of behavior. So they were dressing themselves, brushing their teeth, even potty trained, and now they need assistance or help and can't remember how to do these things. They'll have oppositional behaviors, sensory or movement problems. Sensory will include heightened sensitivity towards light or sound. Everybody's too loud. Again, they may have sleep disruption, difficulty going to sleep without a lot of consoling or melatonin or Benadryl, bedwetting, and even suicidal or self-harm ideations, which is very alarming always. I'm going to just mention here Tourette's. Tourette's syndrome is a neurological disorder characterized by sudden, repetitive, rapid, and unwanted movements or vocal sounds called tics. Tourette's is one of a group of disorders of the developing nervous system called tic disorders. There's no cure for Tourette's, although some psychiatric medications may help. Tics are often found with PANDAS and have shown improvement with avoidance of food allergens and treatment for mold or candida exposure in cases. Most major health organizations deny any relation of Tourette's to brain inflammation, whether from PANDAS or PANS or any other sources such as Cirs or mold. POTS, we've mentioned that once before, we're going to mention it again, but POTS is known as postural orthostatic tachycardia syndrome. This is an autonomic disorder, results in an irregular communication between the sympathetic and the parasympathetic nervous system, the fight and flight, and the rest and digest nervous system. Symptoms come on when standing up from a reclining position and relieved by sitting or lying back down. The primary symptoms include lightheadedness, fainting, and an uncomfortable, rapid increase in heartbeat. I should note here, anxiety is often also felt. And again, hard to diagnose from just general anxiety, as this has to do with the nervous system and blood flow to the brain. Not enough blood to the brain, you're going to feel anxious. That's natural. We have here just a diagram, a quick indicator of just how these things are related. But when you look at autism, it is related to all these conditions that I've previously mentioned. And I want to talk about how they're related in the research. And let's talk about autism and hypermobile spectrum disorder, HSD. They share a lot of commonality between them. They both will have, patients will have children, ADHD. They can have anxiety, neurodevelopmental delays, immune dysregulation, which we see, of course, in PANS and PANDAS, autonomic dysfunction, which we just talked about in regards to POTS, and neurobehavioral disorders, which we just described in PANDAS, for example, and PANS. And the researchers show between 60 to 70%, look at that number, of children with EDS or hypermobile spectrum disorder, meaning if I have a child who's hypermobile, they're likely to have autism, delayed verbal communication, delayed motor skills, learning disorders, or ADHD. Isn't that amazing? Which means when we look at children with these special needs, we need to begin to evaluate also their physical stature and their mobility, and to refer accordingly and or seek help. But this diagram to the right, you see, here's a picture. It's an interesting display of the genetic relationships between these things. You see the yellow circles, those are all genes associated with Ehlers-Danlos Syndrome, which is genetically determined. The blue circles are genes associated with autism and hypermobility. And the green circles are interaction genes, meaning they make connections between the varying genes between EDS and other autism and hypermobile genes. And then we have bars or lines there, one associated with physical interactions, one with shared pathways, and one with genetic interactions. And you can see it looks like a web. You see all those genes there. They're over 50 or 50 connections with multiple connections between them all. So you can see how complex this is. When we start talking about autism and Ehlers-Danlos and even ADHD, there's multiple genes involved here, which is why we have children present in such a variety of ways. There's probably no child that's anything like another child. And this is why. Eventually, we hope we can have typing with genetic testing. We eventually will be able to diagnose somebody with certain genes. We might label them as type 1 autism or type 2 with a type 1 or 2 hyper spectrum disorder. And then hopefully treatments and other things medications may be able to be more specific for that individual. Let's talk about autism and ADHD. Up to 78% of children with autism present with comorbid learning disabilities and ADHD. Huge. Let's talk about autism and anxiety. Common psychiatric features found in both autism and Ehlers-Danlos and hypermobility syndrome include anxiety, depression, bipolar disorder, eating disorders, and suicidal behaviors, which of course is similar to PANDAS and POTS in some instances. Autism and mold, or Cirs. Mold and other biotoxins have been or linked to neurodevelopmental disorders such as autism. Many of you are familiar with the research by Theoharides. And so, again, there's not a lot of research here, but there's enough to be highly suspicious that mold as a biotoxin is a leading risk factor, as a leading risk factor for inflammation in the brain, is associated with increased risk and expression of autism. Autism and PANDAS. There's no current studies linking a higher risk of PANDAS among autism spectrum disorder, but PANDAS is often diagnosed as autism and, of course, will complicate the presentation of any child along the spectrum. And so, again, we believe that testing should be done on all children with autism for PANDAS to rule it out, to make sure. Children on the spectrum of PANDAS will express more anxiety, ADHD, OCD, and neurobehavioral symptoms, and so have a lot more difficulty in managing behavior. And so here's our rule. One is be suspicious. Suspect that children with behavioral learning, mood, or an immune disorder diagnosed with autism spectrum or ADHD or sensory processing disorder or a hypermobile spectrum disorder, these have a high chance of having either PANDAS or Cirs, mold reactions, genetic interactions, food allergies, head injuries, or all the above. It's a mixed bag. And so again, a diagnosis is difficult to make. I mean, it's hard to just give a child a name such as they're autistic or they're ADHD or they're Cirs or they're PANDAS. Again, I feel like these things are so intertwined, and we need to start looking at it and diagnosing it that way. Most of you, well, some of you probably saw, at least your kids did, and maybe the husbands did, the recent Disney movie, The Mandalorian. They always say in there, it is the way, or something of that nature. Well, at our office, we have what we call the EVND way. And that's just a way that a pattern that we've created to help us figure out difficult issues. And And we have 5 rules we try to follow here. First is we take the time to listen together the symptoms for testing and any potential or indicated therapies. Sometimes a patient may present in a way that I can look at it and go, that sounds just like PANDAS. I don't want to give an antibiotic right off the bat, but we'll do evaluation and see if that's the right therapy. 2, we'll run the appropriate test to confirm suspicions and hidden issues. There's often things that are going on in the background that we don't even know about. And again, in most cases, when we see patients in our office, they haven't been tested very thoroughly or at all. 3, we're going to discuss the test results and begin treatments to test our theories. We'll follow the evidence first. Guessing's no fun for anybody. And so we want to follow the evidence, and often it does produce a result as we follow what we see in the testing. And then we retest labs, particularly ones that are easy to reevaluate and that can respond to treatment. And we meet to evaluate response to therapy. And we continue to repeat those steps until symptoms improve. And again, some patients may come in with 5 symptoms, maybe 1 or 2 symptoms improve between testing and or evaluation and treatment. But then again, it allows us to look at what's better, what's not better, and then make some changes in the treatment plan and figure out what we're going to do next. And that's how we figure it all out, little by little. Again, labs become a very important aspect of how we evaluate this. And these are some of the labs that we'll consider using, and they're well known often within the US and have a long history. And again, a lot of are mainstream. But before we get into those sort of off-label labs, we usually start with some standard labs through LabCorp or SnoreQuest. I'm going to talk about a few of these labs, and maybe they're familiar to you. If they are, I apologize, but some are going to be new. We look at, of course, an antibody called anti-streptolysin O antibody. This will be elevated in the presence of strep throat and in the presence of PANDAS, the pediatric autoimmune or psychiatric disorder with strep. Secondly, we're going to look at anti-DNase antibody. This will also be elevated with strep throat, but will be elevated for sure and often in PANDAS or even PANS. And I do see it often in patients with autism, Cirs, and even celiac disease, which is gluten intolerance. HLA mold typing. This is a new for many of you. We're finding a significant correlation towards reactivity to our environment due to mold. Mold is one trigger, but there are many other triggers. And again, when we do these genetic testing and we find that someone is mold susceptible or mold sensitive, we also see this sometimes cross-react with autism and ADHD and hypermobile syndrome and PANS. And of course, lately, it seems to me we're seeing a lot more cases of celiac disease. And so we are trying to test every new patient we see for this. And we can see celiac disease or the celiac disease present in elevating different labs, including the anti-DNase antibody. But so we'll see it elevated and also in PANS. This does not rule out non-celiac gluten sensitivity or gluten intolerance, which requires IgG food allergy testing. And then we look at S100B protein. This is a protein that's been found to be elevated with head injury. So if I have a child in football or is in a motor vehicle accident or hit their head, this protein will elevate. And over time, as the brain heals, it reduces. But we're finding it elevated also, and it can be predictive of inflammation in the brain. And we see it elevated with PANDAS, celiac disease, mold exposure, and in autoimmune encephalitis or PANS. Sometimes PANS is known or called autoimmune encephalitis. And again, there is a great connection between autoimmune encephalitis and the mold sensitivity, which is somewhat of a newer finding or observation. This is the minimum baseline panel that I would recommend on a patient if I had a patient that struggled with getting or giving blood. The next labs could be helpful and would be more expected more in an older patient, teen for sure. But I want to look at the thyroid gland. Again, a low thyroid can lead to learning disorders and depression and anxiety. C-reactive protein can be elevated. A marker of inflammation in the body might be elevated with autism, PANDAS, PANS, Cirs, and ADHD. And I should add food allergies in there too. Some of the nutrients I like to look at too: vitamin D, zinc, selenium, vitamin B12, folate, copper, vitamin B6, and manganese. These will be low or elevated in patients with anxiety, autism, Cirs, or ADHD. Histamine. This is an interesting. It's associated with some individuals have a condition known as mast cell activation syndrome, which I listed there. This condition will release more histamine. Food allergies can cause this, or environmental allergens. If I have a child with excessive immunoglobulins, IgE, which indicate reactions to flowers and trees and cats and dogs and horses, which is really sad for the kids. They will have histamine issues, and certain therapies may be helpful here, but we can see this cross-react with many conditions also, meaning it'll aggravate them. And then we can look at immunoglobulins, IgA, IgE, IgM, and IgG. Again, this can be elevated in different ones. And again, in immunodeficiency disorders also, which can be difficult and difficult to diagnose. Toxic metals, elevations can be associated with autism, PANDAS, anxiety, and ADHD, and infections. Numerous infections, Lyme disease, strep, as we've talked about, pneumonia, mycoplasma pneumonia, chlamydia pneumonia. These can be associated with PANDAS, PANS, anxiety, ADHD. A lot of these labs are covered through standard labs, and generally we use LabCorp. I want to talk about some other ways that we look and assess individuals. And one of those ways that we do specific in our office is called brain mapping, or QEEGs. This describes a pattern of electric activity arising in the brain or from the brain, which is divided into ranges known as delta, theta, alpha, and beta brain waves. These are the increased or slowed processing in various regions of the brain, as shown on a brain map, are predictors of behavior, attention, inflammation, and mood. Brain maps can help to confirm or raise suspicion of certain diagnoses, such as ADHD, anxiety, PANS, autism, and learning disorders. It's also able to predict improvement in symptoms based on research with various interventions like neurofeedback therapy and even hyperbaric oxygen therapy. So there are some known therapies that are helpful in autism, and you can do pre and post brain maps to evaluate progress. These are covered by some insurance plans, but also affordable options available through the office. I want to show you what a brain map may look like here. I'm going to pull this up and share this with you. Right here is a presentation of a brain map, and you can see there in the top section these head-looking shapes, kind of a nose and ears. And you see different colors. The gray is considered the normal color, meaning when compared to a database of normal people, or I guess people without any problems, we would see more gray. If we have problems in the brain, we're going to see red and yellow colors, which indicates intensity or increased activity. And if we see light blue or dark blue, we're going to have slowing activity. We see there in the delta and theta, for example, in this presentation, this indicates inflammation in the brain and can be elevated with issues with focus and attention, and even autoimmune encephalitis or PANS. We also see the beta over on the right side, where you see the dark blue. That again, the brain is asleep. It's not able to focus and pay attention. If you're a lion, you just missed the kill. You were taking a nap. So again, we can do different therapies to improve the electric activity and flow. And so that helps us in the diagnostics. I'm going to go back to my slide. And so brain mapping is an option here. Let me go to the next slide here. Again, if you're not familiar with this, the Autism Treatment Evaluation Checklist, or ATAC, is a way to evaluate through questionnaire the baseline and improvement in symptoms over time as we do treatments. I recommend every child participate in this evaluation. As they're doing treatments and assessments, we can go back and reevaluate, and we'll talk about some studies that have been done with various treatments here using this checklist. Let me talk about some other testing and some research here. Research and experience have also found the removal of gluten, dairy, corn, and soy in the diet of an autistic child results in the reduction of inflammation and often significant observable improvements within a few weeks in 91% of autistic children, meaning 91% of children autistic respond in some way favorably to removing food allergens. Gluten and dairy are known to also be linked to leaky gut, mast cell disorders, folate deficiency, food addictions, and elevation of the toxic neurotransmitter glutamate. Food allergy testing can confirm the suspicion and often the degree of even candida or yeast reactions. I want to share with you for a moment and just kind of show you what that might look like. Here is a sample of a food allergy test or result. You can see here 4 columns: dark green, light green, yellow, and red. And you see black bars going across there. And anything probably in the dark green showing a mild reaction, probably not significant. But as I get certainly in the yellow and the red, these are strong indicators that our immune system is reacting very intensely to this food. And the food testing we do today tests around 190 foods, so very comprehensive and a very effective way of discovering allergy reactions, IgG-based allergy reactions, not IgE, which is more anaphylaxis, but IgG, which are slow, delayed onset reactions, which we're going to see most often in children with behavioral or mood or learning disorders. I'm going to go back to my main slides. Again, I put the pricing there in case anybody was interested. And if you, I want to make note, in the handout section, I did give examples or provide a handout. You could download any of these tests or example reports of what these look like, so you can review those to evaluate whether or not you've done something like this in the past or would like to do this something like this in the future. Mold. Exposure to mold and mycotoxins can affect the nervous system directly and through immune cell activation, thus contributing to neurodevelopmental disorders such as autism spectrum disorder. We had mentioned that earlier. I want to show you a sample report of a mold test, and this gives you an idea. And these are things that you can that you can evaluate. And this is only a sample, 1 page of a report, for example. But we can look at exposure to aspergillus, penicillin, stachybotrys. But if you end up with an elevation in which is represented by the black bar as it elevates into the red region, that would indicate exposure to mold within the environment. This is a very easy test to do for children. It only requires a urine sample. And again, this would be, of course, more alarming in a child who has Cirs, or Inflammatory Response Syndrome. And certainly in any child with autoimmune encephalitis or PANDAS, we would be highly suspicious of mold. This one's new and maybe new to some, and the other ones are becoming more familiar. And understand a lot of these things weren't even available 10 years ago. And so more so, one of these examples is the folate receptor antibody test. Vitamin B9, known as folate or folic acid, is essential for the brain for proper human growth and development of a healthy nervous system. And we can have issues with the folate receptor, which transports folate into the tissues of the brain and other tissues. But if we develop antibodies, which can come for varying reasons, we don't really appreciate quite why, but if antibodies to the folate receptor are present, then there's an indication that folate is either being blocked or binded by these antibodies, and it's not being properly distributed across the blood-brain barrier. You can do this antibody test, and I listed the lab there, Iliad Neuro, and you can run this test. We do have this test in our office. You can order the test. It needs to be drawn by a physician or at a lab and then sent off. If it comes back positive, then a trial of phelinic or leucovorin can be given to bypass that specific receptor issue. And the studies show, and this study was done by Dr. Fry, who is a major researcher in autism, showing that treatment with high-dose phelinic acid or leucovorin resulted in improvement in verbal communication, particularly for those who were positive for this folate receptor antibody test. I'm going to move to the next test. Interestingly, there's better and better labs, and so I want to present one here that's come up recently with one of our labs, Vibrant America, a food additive panel. The U.S. FDA is yet to study the effects of synthetic dyes and other food additives on behavior in children. This is a sad, sad place to be. Many other countries have been doing studies on this for years, and one of those studies is out of England, showing a link between food dyes and hyperactive behavior in children and learning disorders. So again, we have a long ways to go, but one way to evaluate that, and this can be very difficult, but is to do a test. I believe I have a sample of that one here, and let me pull that up and show you what that might look like. And looks like it looks like we didn't scan that in right. I apologize. So we scanned in the wrong page, so I can't show you what that looks like. But on our website and through another link I'll show you here shortly, you can view that test and take a look at that a little further. Another one here that's come up in recent years associated with glyphosate. Glyphosate is the world's most widely produced weed killer. It's a primary toxic chemical in Roundup. And so you've heard of those recent lawsuits and that have been won against Roundup, causing cancer and other things. It's in other herbicides, over 700 different products that that glyphosate is found in. The usage of glyphosate has increased with genetically modified glyphosate-resistant crops or GMO crops such as corn and soy. And so there's graphs and studies that have shown that the rise in autism correlates with an increased use of glyphosate on corn and soy between 1990 to 2010. And so there's a test here that we can run also on this one. And again, hopefully loaded that one up correctly. And there it is. And a very simple presentation. You either have some or you don't. If the black bar represents the amount, and you can be 1 or 2 deviations or in the 95th or 75th percentile for exposure to that. And of course, there's a lot of detox work that we can do, including sauna, detox foot baths, a lot of great therapies that can help reduce those toxic loads. Another test that we do is an organics acid test. This provides a metabolic snapshot of certain byproducts of metabolism that are discarded by the body with urination. The OAT test reliably detects overgrowth of yeast and bacteria, so a lot of people use that. I will say the food allergy testing also looks at yeast and candida allergy reaction. And so between the two tests, you get a pretty good reliable idea of yeast or candida is present in the body or the intestinal tract. And it looks at a lot of different metabolites associated with vitamins, neurotransmitters, mitochondrial function, and can give you an idea of how a child is detoxing. I'm going to, I'll leave you to be able to look at that one at a future date or later on your own. And then another test that's very interesting is a toxic metal test, which we can do both a urine sample depending on the age of the child, or we can do a hair sample. But baby teeth from children with autism contain more toxic lead and less of the essential nutrients zinc and manganese compared to teeth from children without autism. The researchers studied twins to control for those genetic influences and environmental factors. And so again, it probably suggests that some individuals are more able and readily able to get rid of toxins as they're exposed to them. And it seems that our autism population seems to have difficulty with removing metals from their environment. Now, I guess let me review some of the ideas. We've talked about some testing. This course is not a conclusive. This is a lot of things that we like to do, and there's other tests that are available. But I want to talk a moment about therapies. Where do we begin? And so this is kind of our approach and how we begin to address some of these issues that we recognize based on the research and based on experience. While waiting on LAMS and development of a treatment plan, we like to begin a treatment for reducing fungal and yeast overgrowth in the intestines. So again, depending on the symptoms, we may provide a prescription that effectively reduces candida load while avoiding refined sugar. I might recommend in some cases, depending, again, we got lots of expressions and different flavors of these issues that are going on, but might recommend a candida diet, which is reduction in grains and sugars that would feed yeast and candida. This can be found in our forms and handouts section on our website. In the absence of IgG food allergy testing, I mean, if I don't have a food allergy test to show it, we will recommend trials of avoidance of gluten, dairy, corn, and soy to observe possible benefits. And of course, we recommend always a fresh diet free of food additives as best we can. And this, of course, this takes time. We don't expect that these changes happen overnight. And it takes a lot of work to perfect it when the predominant food that we have supplied to us is laden with so much toxins and poisons. It's best to combine a candida diet, a food allergen avoidance, and food additive avoidance at the same time, if possible. That's a lot of work, I know. We like to start, too, with foundational nutrients that support methylation, inflammation, and detox pathways. It doesn't matter necessarily what the labs say. Again, we can easily observe when you provide a few different nutrients. And one of those products we see in autism is a product such as Spectrum Needs, and there's a few out there that are similar in their design. These go after the genetic issues associated with methylation and MTHFR. And again, parents will report. We notice improved learning, behavior, cognition, verbal communication, or eye contact, something of that nature. Again, some patients will report improvements with fiber. Fiber can feed good bacteria in the gut and help with constipation or slowed motility. And of course, fish oils are anti-inflammatory. We understand in the history of autism, two of the leading issues is inflammation in the brain and free radicals, right? And so a lot of these things that we're discussing today address inflammation and address free radicals. And I should need to add that as a slide because that's so important to remember. And that's why so many therapies that we talk about here do address those exact issues. And hyperbaric oxygen therapy is one of those. We know that in autistic children, there seems to be a reduction in perfusion, meaning blood flow or blood distribution throughout the brain. This leads to increased inflammation. As we do hyperbaric, we reduce the inflammation and improve ATP, which is adenosine triphosphate, which is the energy source for all cells in every part of the cell and in the mitochondria. Again, this shows great benefit in our autistic children. Specifically, we see benefit in repetitive behaviors, inflexible routine, underdeveloped language skills, and difficulty expressing and recognizing emotions, as well as facial cues and gestures. We mentioned earlier leucovorin. Again, at some point, we'll consider a trial and start a trial of leucovorin. We find this to be a very safe therapy, and with or without testing, it's worth a try to see if it helps improve communication and verbal skills. And we've seen improvement in eye contact, meaning increasing and maintaining eye contact with the use of the leucovorin. That's fabulous. Neurofeedback. We mentioned neurofeedback. Well, we mentioned earlier brain mapping, and brain mapping is the baseline report for developing a protocol for neurofeedback. Neurofeedback, a therapy that's able to help retrain and rewire the brain, improving self-regulation, which can improve learning, behavioral issues, and attention issues. And so on the left column here, we've listed a number of things that the research have shown that neurofeedback is able to help. Learning disorders, sensory overload, or sensory processing disorder is another term, behavioral regulation, certainly communication, attention or focus, verbal and social engaging, reduce self-stimulatory behavior, hand flapping, for example, follow through with verbal request, meaning, hey, go get your shoes on, and they do it, and that's always a miracle sometimes. We see an increase in empathy and better sleep onset and duration and less anxiety. Detox foot bath, another therapy that we've added to our clinic in this year for both children and adults. Again, this requires just placing the feet in the bath of water for 30 minutes with a low electric current. It's not painful. You don't feel it. These ions act like magnets and attract other charged molecules such as toxins and direct them to be released by the tissues where they've been stored. This ignites further detoxification and elimination from the liver and kidneys to remove these toxins from the body. This is very safe for adults, but certainly for children. In studies with the detox foot bath results in a significant release in chemicals like glyphosate, which we talked about, and also toxic metals, which we discussed. And again, I mentioned the autism treatment evaluation checklist has been used as an evaluation tool and showed a significant reduction in symptoms of autism when using the ion cleanse foot bath, which is one of the leading foot baths available in the US. So let me talk about next steps here. We're coming to a close here. In our handout section, we have a handout that talks about or presents an autism treatment plan. It has many of the ideas that we've discussed. It's also found on our website under forms and handouts. You can find the autism treatment plan. If you click on it on our website, it'll carry you through the links and go through the education and more detail into the research behind many of the therapies that we're recommending today. And that can be very helpful to create a baseline. Now, some of you who are beginning to do this, that may be helpful. If you've been down this path and you're familiar with every treatment and modality that we've discussed today, then what you want to do is pick out things that have been missed. But it's good as a review, and it helps us to make sure we didn't miss anything as we build a program for each individual. We recommend often for children with any type of behavioral or learning or autism or PANDAS or PANS, any concern there, to do brain mapping as part of a new patient visit. We highly discount this brain mapping. It provides for us a lot of great information when we're looking and trying to figure out what's going on in a young child. Of course, we're going to review all the lab options and schedule the appropriate labs. We don't have to do all the labs that we've discussed today. That can sound overwhelming. We might recommend, finding one and doing one at a time, and they should build on each other. And as we do, we begin treatments and we begin the therapy, and we observe how helpful that has been. And we can repeat the labs that are necessary to evaluate response. Well, that concludes our presentation tonight. There's much to talk about. Again, at this point, I think we want to answer some questions. I'm going to invite Dr. Nevels back, and she can moderate and help us make sure I try to answer those.
Hi, that was fantastic. Thank you so much for your wonderful presentation. We do have some questions here, so I will go ahead and start by reading through them. Excuse me. So first question is saying, what about exposure to toxins, for example, glyphosate, DDT, passed down from grandma or mom, etc.? How are those related to all these conditions, and does that impact the HLA genes or a separate issue?
Well, and these are difficult questions, and there's not necessarily studies that connect all these things perfectly together. I think that a lot of these things are separate issues, and I think that they start to compound upon one another. And for example, someone who is HLA mold positive is going to likely have more inflammation and be more immune reactive in the presence of other toxins like glyphosate, whether it was passed on, say, through environmental exposure, or say passed on through placental exposure while they're in the womb. Dr. Nevels, as a specialist also in environmental medicine, would you comment anything else you would say on this?
Well, we know that toxins, stress can affect genetics, and particularly epigenetics. And so we know that with research that they can alter genes. What specific genes, I think, vary. So ovarian health, testicle health, and there's actually good studies on the epigenetics with glyphosate, particularly. I can't regurgitate all that information, but I do think it's a bit of a separate issue. But again, everything blends together.
Yeah, I think that's what we're talking about. When autism, it's multiple things intertwining with multiple genetics. And as we see, I showed you that diagram in the very beginning, and just some of the interrelations or genetics just associated between autism and hyperextensibility, hyperflexibility disorder in children. And that's just that one connection. And I think in time, as genetics come out, they're going to play a bigger role in predicting what's happening. And so hopefully that answers that question. Okay,
next question. If your child has a double mutation for MTHFR, is that related at all to FRAT? I've been under the impression that it is also related to folate and the blood-brain barrier. Can you speak to that?
Yeah, these are difficult questions. They are not the same gene, or they're not the same problem or the same issue. MTHFR is a SNP, or it's a variation in a gene that basically requires a special form of folic acid to make sure that the methylation pathway moves at a rate that's appropriate for the individual. And that's a very confusing topic and very individual for each person, adult or child. The FRAT is whether you have MTHFR or not, you can also have these FRAT antibodies. And so, and again, interestingly, this can be confusing because we use different forms of folic acid for this issue. And so again, and it's hard to get into that controversy whether or not these are competing for each other. That's going to be a difficult question to answer. But again, we need to, in these cases, do treatment and observe benefit.
And likely you do both methylfolate and the folinic. Yeah.
Correct. And so they can be both done. It's rare to add methylfolate into an autistic child and expect to see major differences. More likely we'll see aggravations. But the FRAT or the addition of the folinic acid or leucovorin, you can see benefits within actually days or weeks, a few weeks, which is quite phenomenal, wow. Quite impressive.
All right, thank you. Next one is, what is your opinion of why so many children are suffering? For example, dirty food, vaccines, leaky gut. I mean, I think your presentation.
I think you just answered it. Yes.
All the above.
We do see certainly these things seem to have increased at an alarming level or rate. And again, it's why that we become more familiar with them, because we're seeing all sorts of flavors coming into our office. I do think that it's environmental. That's my opinion at the moment. And there's a lot of research to back that up. And I think a lot of doctors, alternative doctors, feel that same way. But I believe that the additives and all the things that are in our food, and of course the glyphosate and pesticides and herbicides and the metals, and again, we could say the sugar, but all these things together are disrupting our microbiome, creating leaky gut. They're suppressing and unbalancing our immune system and making us more reactive. Now, some of us are more sensitive to our brains being, I think, leaky. We've heard of leaky gut, and I think we have what we call leaky brains. And again, I think genetics in time will show that some people have more of a leaky brain than others. Now, one correlation that I didn't mention here is in regards to Ehlers-Danlos Syndrome, that's a hyperextensibility of the connective tissue that holds joints and the body stable. Well, our thinking at the moment is maybe this extensibility or hyperflexible connective tissue is also surrounding our brain, meaning the brain's porous, it's open, which means things are going to leak across more readily. And so Ehlers-Danlos Syndrome or hypermobile spectrum disorder could be an increased risk for having more of these issues such as PANDAS, autoimmune encephalitis, autism, and so on. Meaning I think these genetics are more interrelated and interacting with one another, setting some of our children up for major problems early on. And our environment isn't helping. And our food is hurting us, absolutely. So we're going to talk about intermittent fasting next time. Don't eat.
Okay, another question. Can an epileptic do the foot bath? And I believe because of the electrical current, typically it's contraindicated in someone who has epilepsy, but perhaps, understanding more that individual's health history would make us sway differently. But typically, no.
Agreed. I would probably be concerned just in case, because potentially if you pull toxins that are there, you could make the patient have a seizure. I think carefully working with the doctor to evaluate all other risks and do what you can in other ways to reduce those risks or symptoms would be a safe approach. Even though it is a safe treatment, again, there are a few contraindications or conditions that would be potentially risky. Mm-hmm. Not enough studies. Some concern there. Thank you.
And a question, will there be a link to a recording of this that we can share with others?
We plan on having that available, and hopefully we can send that out as soon as we can. We're doctors. We're not necessarily technology savvy, and we rely on a lot of other people to help us. So as long as those people step in and help, and we've lined them up, and we hope to have
That's
that
our plan. That's our plan.
Yeah.
And then thoughts on homeopathy. We have a few more thoughts on homeopathy.
Well, I love homeopathy as a medicine is just a phenomenal medicine. I'll speak personally. I'm not very good at homeopathy. I use it a lot in my own personal care, but I have, very few things that I use. There are a lot of doctors who use homeopathy, and I think it works great in conjunction with things that we're doing, everything that we've talked about today. And there's many other therapies and modalities that I haven't discussed today that could be helpful. And again, we've spent already close to an hour, and we could go on and on, but I love homeopathy and it can be useful. I know I've heard some people say that only homeopathy is the only medicine that works for autism, and I don't agree with that statement. Again, in the research, there's a number of therapies and treatments, as I've reviewed today, that are quite extensively helpful, in the range of 70-90% improvement, right? So again, it's one therapy of many, and it's very a positive or healthy or a good one, a safe one. No risk.
Great. And then someone commented on, thank you for talking about EDS. So that was very nice. And then,
thank you. Let me comment
Sure.
on that. We kind of, our inspiration for doing this lecture initially was to begin to recognize that EDS and Ehlers-Danlos and this hypermobile spectrum disorder actually is connected to a lot of these conditions in the children. And this research is new, and it's quite phenomenal. And again, we need to start recognizing it and figuring out how we're going to support these children with the varying issues. And this is part of it, and we need to start looking at these and how are we going to help and support children with these issues, and adults for that matter.
Great. And then what got you into natural medicine? Thank you for time tonight. Very informative.
Well, that's a long question. And let me just say, I, at a very young age, and in my early 20s, while going as a student at ASU and going into business and then into exercise science, I recognized that medicine was ignoring the proactive approach that people could take to take care of their lives and themselves. And so I knew that at that point, I wanted to become somebody who was going to promote health in a natural and in a way that also required patients and individuals to take more personal responsibility, which is not always easy. And so, again, it started there. And again, I got exposed to natural medicine, and that game over, right? We're here today.
Thank you. All right. One last one. What age range do you work with?
Pretty much any age range, but when we're talking about autism, most cases the symptoms start presenting as early as probably 18, 24, or usually around 24 to 36 months. So generally as young as that age. And again, in the most research and behavioral therapy, the earlier we start therapies on all these issues, the better the results, the quicker the recovery. The longer things go on, and that's part of our message too, is we need to recognize that there's a lot of hope for all these conditions, that we shouldn't just stick children on medication because they're having behavioral or mood issues, that there's a lot of different therapies and things that can help in an immediate way. And if we can catch it early, treat early, we can reverse often the conditions or help them significantly. And I've seen cases of early onset of autism completely reversed, and those cases are out there. But it does get harder as we get older to try to reverse that. It takes a lot more therapy, we'll say. It just takes longer.
Okay, well, thank you again for a wonderful presentation that you displayed tonight. Any closing thoughts or words?
Oh, I think I've said enough. Again, if you have any other questions or concerns, please let us know and reach out to us. We're here to help. If you know anybody who would like to, would have appreciated and it wasn't present, then please forward the information and let them know about what we do. Again, we try to create what we call very easy and processes to follow. And again, we don't know everything, but we know a whole lot more than we used to, and we want to share that with everybody so we can help our children be their best.
All right.
That's it.
That's fantastic. All right, everyone. Have a great night. Thank you.
Thank
Bye.
you.